Hi, this is Dr. Roy Kim. If you're a teenager or young adult, you may be grumpy because you have acne. Let me assure you that there are ways to fix it both non-medically and medically. Non-medical, the way to go is to consider having the resources of an esthetician, so I'll talk about that. And if that's not quite good enough, where you're not getting all the results that you want, then yes, you may need medical grade consultation, skincare, and help. I'll discuss how adult acne starts, the treatment, and how to prevent it. So, as you probably know, with the teenage years, with puberty, you go through hormonal changes. So, some of what happens is with the surge in hormones, maybe a poor diet and stress, you're gonna have your pores being blocked up. So one of the causes we think is that the pores in your skin, especially facial skin, but interestingly also your chest and back areas, the sebum, S-E-B-U-M, clogs the pores. So if we can sort of eliminate that, or that natural surge when it happens during puberty, your acne will definitely get better. So as you know, if you don't really clear out your pores, you may have whiteheads, blackheads, pimples, cysts, and even permanent scarring. The goal here is to clear out those pores, make sure that you have very healthy skin, and to prevent any long-term scars from happening. In terms of things that you can do, yes, you may identify certain triggers which cause your acne to occur. So try to avoid those. Whether it's a stressful environment, honestly, a lot of dietary considerations, including high fat, high glycemic, or other stress factors in terms of your diet. Try to avoid those things if you notice that your diet or certain things in your diet happen to trigger them. You can obviously blame your parents because some of this is genetic, but yes, we're going to talk about the things that your esthetician can help you control. So if you go to a great esthetician, they may recommend good skincare products which help clear up your skin. They may also recommend a facial. Now with facials, especially with mild to moderate acne in teenagers or young adults, it is amazing. So we're talking about a great facial where they clear out your pores, and literally in a day or two or three, you're going to notice a dramatic improvement. That's always one of my favorite things when I refer some of my patients who don't need medical care quite yet to my favorite estheticians. Another cool thing that estheticians have are LED lights. So blue lights can help with the surface in terms of getting rid of bacteria, and red light sort of penetrates a little more and can actually help with reducing inflammation. So definitely discuss this with your esthetician. These are over-the-counter products. However, an esthetician will know how to use them and probably have better products than what you could use at your house. Another thing an esthetician can do is recommend exfoliation. So specifically, we want your skin to peel off and new skin to grow, which has less acne, fewer wrinkles, less sun damage, less scar damage. And even though you're young, yes, we want to avoid scars. So definitely discuss with your esthetician about the possibility of lighter peels. In other words, they're still very effective. However, they are not medical grade / prescription grade products, which is probably what you do not need at a younger age, or you may not need if you have a mild or moderate case of acne. Now, of course, maybe you've tried these things and they've helped, but they haven't helped enough. Then you need medical grade stuff. This is where I come in. So after consultation with me, you may require prescription grade skincare. There are several options, including things which I consider moderate to very strong prescription medications, including Accutane, which I definitely avoid unless you have a moderate to stronger case, which has also failed other treatment. So it depends on your specific case, what you've had done recently, and there are ways where we can actually give you prescription medications, but sort of on a weaker or lower scale, which will definitely help clear out your skin. And I still think it's important to see an esthetician to clear out your pores, possibly monthly. So it depends on you. And I know I'm being a little vague, but really I would not jump to prescription skincare immediately. I would definitely try to do things on your own or with an esthetician before you jump to prescription skincare. Also, there, interestingly enough, are cortisone treatments. In other words, steroid injections which help reduce the inflammation of acne. Typically, I would not do this unless you have a major event or major photo shoot that we have to immediately suppress your acne. So think wedding or family reunion or something like that. So this is not a common treatment in teenagers at all, but it is an option. So with this short introduction to aesthetic and medical grade options for teenage acne, young adult acne, I hope you understand now that really one of the foundations is taking responsibility and taking care of yourself first. Maybe you need some advice, and definitely we all need help with esthetician skincare goals, including facials, clearing out your pores, exfoliant peels. These are things that even, I'm a doctor, I can't do these things. You need the help of a professional. So I hope this clears things up, and I hope you understand now that, hey, we need to clear out those pores. There are ways to do it by yourself. There are ways to do it to prevent your pores from getting clogged in the future, and an esthetician as well as potentially a doctor may be your best friend in the near future. Thanks so much for watching.